very much for waiting. If you have been waiting for my show, this show we started with the sole aim to help startups around the world, and mostly those who wanted to um, build, create something in healthcare space. So, without wasting any more time, I'm going to talk about the format of this show. It would be 20-minute show, and we are going to spend first 10 minutes talking about the biggest opportunity, any kind of merger or acquisition deal which creates in the market. And right now, the deal which I see, Oracle acquiring Cerner, is one of the biggest deals in the market. And we'll talk about it in a little bit, but I'll tell you what has happened recently. So if you see, there was a story. There was a story published about Cerner, um, and then there was a story published about the Oracle. And listen what Mr. Tony Blair has to say about this story. All over the world, especially in some of the poorest parts, and we're very proud of our partnership with Oracle. The aim of the Institute is very simple: to help leaders to govern better by providing the solutions which will allow them to build societies which are prosperous, inclusive. So, you heard this was Prime Minister Tony Blair talking about the deal, the acquisition which Oracle did for Cerner, and how his foundation's partnership exists. So, in this deal, I'll tell you the few key points what has happened. Oracle has acquired the largest EHR vendor in United States, Cerner, in $28.4 billion. That's the first thing which has happened. Oracle CEO Larry Ellison, he presented this whole deal in front of the world through a YouTube Oracle live session last week. And the session which I just showed you, it was a part of that. And what he talked about is a story that, which is very intriguing story, but it's a very old story that if you run into an accident and you're out of state and you have no control over your medical records. So if you go to the hospital, you run into an emergency center, how they're going to treat you if they don't know your medicines, you're taking any medicine or not, or you have any existing medical conditions which prevents you for any further treatment, any allergies, any blood work, any MRIs, anything in your body already. They have to do all the tests all over again. And that story is pretty old story, but people talk about it all the time that whenever they are going to acquire something in healthcare space, they are going to fix the problem of global exchange. Now, what is global exchange? This basically, in United States, CMS has been trying to create an exchange where all of your medical records information would be shared between different stakeholders, between the hospital, between your primary care doctor, between your referring provider doctor, or anybody else who is the part of your care. Now, with this in mind, Oracle's chairman and CEO says that it's going to the kind of software we are going to develop in future with the help of Oracle. We are going to do. We are going to focus on better outcomes. We are going to focus on better patient care, and eventually it would be a uniform platform where the information can be shared across the board. Now, one thing which has came out or stand out from this acquisition for me, uh, why Oracle, which is a data company, would buy Cerner, which is an EHR practice management company. Now, think about it. Cerner has been into the business for the last 40 years. Their technology for healthcare was instituted in 1982, so it's just almost a 40-year-old company. Now they have Cerner and Epic. These are the only two companies which are largest healthcare data science company or practice management company or some kind of a hospital software where 70-80% hospitals in the United States, their data runs. So the amount of this massive data, this volume, That is the key reason why this acquisition happened, in my view. Because again, it's all about data, data, and data, and more data. So if you see in last few years, there are over 500 data mining companies which has suddenly just cropped up. And out of those 500 data mining companies, half of them are in healthcare space. What are they talking about? They all are trying to create better outcomes. They all are trying to give tools to physicians. They all are trying to empower physicians or healthcare market where they can be the part of better outcomes, better solutions, and more efficiencies. Now, with this, where is an opportunity for startups? With this, where do you see an opportunity for startups? So I'll tell you there's one place where you see an opportunity for startups. And that place is when something breaks or something break down or there is a problem happens, there's a challenge comes, then it creates an opportunity for somebody to build solutions. And that's exactly happened in the case of Cerner EHR. So if there is another news which has broke, and I'll show you that news if I can, but there is a news which came. So I'll give you a little background. If you read this news, I hope you can see it. VA EHR modernization delays. It was a $16 billion budget in last 2 years. Cerner was paid to implement EHR entire in across the board on VA health system. Even after 2 years, that project did not go as per their standards and it is still in limbo. So think about it. $16 billion. The total deal, Cerner, uh, uh, um, um, Oracle is acquiring it in $28 billion. Out of that, the one contract alone is a $16 billion contract they had in last 2 years. There's another news. There's another news which has, I'll show you what happens. Cerner EHR has gone down 50 times since 2020. Now, even after spending so much money, if the system goes down 50 times just during the implementation time, what do you think is going to happen? What do you take? What's your take on this? This provides you an opportunity for startups, consultants, vendors across the board what they should do or they should be doing with Cerner and Oracle together. And that's what I see an opportunity. So with this opportunity, I see a lot of people would be developing apps for them. We see a lot of consultants would be hired to keep the system up and going. um, Vendors would get employment. IT vendors would get employments. So these are the things which provides an opportunity. And with the Oracle, if you're an Oracle developer, in future, I see a lot of opportunities hitting just because of this deal. Cerner has an opportunity place. It's a marketplace for app developers, for people who wants to build their solutions around the system data. So it is a great opportunity place. Now, how do I see it? I see the data is going to be a big deal. So anything you do in the data mining, it would be a great benefit. Another opportunity I see is uh, how many platforms or um, interoperability. So there's a one keyword which I wanted to talk about today in all of this scenario, which plays a key role, is called interoperability. Now, interoperability is not simple thing. So if you see, according to the Act, 21st Century Cures Act, the interoperability means health information technology that enables a secure exchange of electronic health technology without any special effort on the part of the user. So what it does means, in a simple language, if you are a patient, you go to one doctor And if you have an access to this technology, all of your medical records will sit somewhere on the cloud where that information is accessible to you as well as somebody who is a part of your care provider. So, a simple example, if you're seeing a doctor in the hospital, all of your data and your medical records, your demographics, your insurance information, your treatment plan, your um, review of systems, or if a doctor has dictated something about your analysis, prognosis, all of that information, your MRI, your diagnostic labs, pathology labs, reports, will go seamlessly and transfer to the other doctor. Or you have 3 or 4 doctors. On an average, a patient is seen by 7 providers for any small disease or anything which happens in his lifetime. So think about it. All of these 7 care providers have the access of the same information using this particular interoperability. And the term interoperability works uh, seamlessly between different systems is a job of any consultant or any software, or there's a different type of softwares. They want to need to be seamlessly working hand in hand. But this particular interoperability, it provides you a legal exchange which connects between all these different softwares. So here is an opportunity. We talked about interoperability, we talked about the deal, we talked about data. And then I would talk in the end of the show, I would be talking about one more thing. What is a startup tip of the day? So that comes from my own experience. What is the tip of the day for startups? So my startup tip of the day is when you want to start your own healthcare startup or healthcare. Um, so here is a tip of the startup tip of the day. When you talk about the healthcare startups, think about your business model, and the business model structure has to be in such a way where the reimbursements, as well as, because when we talk about different type of when we vet different type of startups, we see who's going to be the payer or reimbursing for the cost of the product or the cost of the software or cost of your, who is the customer. And that is called a structure, called a business model. So you have to be very careful. I'll give you an example. In a healthcare scenario, when you create a product for a patient, that patient is not paying to you. He is not your customer. He may be your end user or a consumer. Your payment or your model reimbursement is coming from his insurance company, because they are the ones who are paying for that. And that is the reason a lot of these healthcare ideas fail, if they are unable to identify the structure well. So this is my advice in the end. As a startup, as a healthcare startup, please do take care uh, of this one thing in the very beginning, how you want to structure your products and services so that you know who's paying for it. It may not be necessarily patients or providers, but it may be the insurance companies. So with this, let me know, give me the feedback about this show. Today is the first day. I don't want to be too much information for you. I know we had a technical glitch, so if for any reason you saw my previous video that was not the good one, we are going to delete that video, but this is the final stream. Thank you again very much. I hope our show would take you and help you to implement some good strategies in your startup journey. So thank you very much and have a great day.